Hey guys, and welcome back to my YouTube channel. This is the fourth and final installation of a 4-part series, giving you the information to understand what is functional medicine, how does it differ from conventional medicine, how can you utilize this to drive your health, and finally, what are some actionable steps that you can take to begin to address your health from a more natural and holistic standpoint, as opposed to one governed by the conventional system, which is using and taking drugs. And as always, I'm Scott Resnick. I'm a medical doctor who believes that you guys can be empowered to become best stewards of your own healthcare, to learn how to address all aspects of health and healing without using drugs, and to live in a state of health versus one of disease. I want to recount 2 short stories because the purpose of this video is to help you to understand who should you trust, who is a qualified healthcare professional who can help to guide you along this path. Again, the purpose of these videos is to give you guys the tools that you need to make good decisions. So I was in my office one day and a patient came in, and like so many of you, she'd been using a variety of supplements recommended to her by a variety of different providers. I mean, she'd had something recommended to her from her chiropractor. Her conventional medical doctor recommended some supplements as well, and so did her hairdresser. But what happened is that she took so many supplements, collectively, she gave herself a state of B6 toxicity. Folks, this is real. And what she had was a pretty significant amount of numbness in her fingers and her toes, which should be reversible by discontinuing the vitamin B6. But the operative word here is should be. So because she didn't consolidate her care, and because she used so many different supplements without really knowing exactly what was in these supplements, she caused herself to have a nutritional excess in the vitamin B6 that caused her to have some pretty significant and possibly lasting symptoms. Another time, I was sitting in my office and a woman came in who'd been seeing a natural doctor in the next state over. And she was an attractive woman who came in with a scarf around her neck. And I said, "What are you here for today?" And she said, "Oh, my doctor has been treating me with natural herbs and potions for a rash that I have on my neck." And I said, "Oh, let's take a look at the rash." And she slowly undid the scarf and revealed that what I believed to have been a head and neck cancer that had actually eroded through the skin. Now, this woman had been working with this provider for perhaps a year, applying creams and potions to something that, in my professional opinion, was a head and neck cancer until proven otherwise. Now, this is serious stuff, folks, because this in time, if not treated or resected, can actually serve to not only invade into vital structures, but also to occlude her windpipe. So we spent the remainder of the visit finding a good head and neck surgeon in her neighborhood and getting her set up for a CT scan of the neck to help to define what this actually was. So what I've done is I've shared with you 2 examples in which patients who actually came into my practice had been hurt by not following a coherent approach and just using supplements and taking recommendations in a willy-nilly fashion. Admittedly, I do have a bias. I've been doing functional medicine for 15 years. I'm formally trained in general surgery and obstetrics and gynecology, and I feel that this, in addition to having done a fellowship in metabolic and anti-aging medicine, helps me to bridge the gap between conventional thinking and really the wonders and opportunities that are found in natural, functional, and alternative medicine. The purpose of this video is to help you all to find practitioners who are qualified to assist you on this journey. And let me just say this, that credentials matter, because I have done 4 years of medical school, 6 years of postgraduate training, a fellowship in metabolic medicine, and have practiced for 15 years. I think that all of you would agree that I might have more insight into the way that the human body works, the way that these different systems I've talked about contribute to disease states, than, say, a chiropractor who is in his or her 2nd year of training. Now, don't get me wrong, there are plenty of qualified chiropractors out there. But when you're looking to work with somebody, I want you to recognize that credentials and experience matter. And in my bias, my experience shows that medical doctors and doctors of osteopathy probably have the best training and the most experience in their formal residency training to understand what's going on with the body. Naturopathic doctors are a close second, and then following that, we have a variety of different specialties, such as chiropractic or nutritionists, and these are all qualified in their realm of expertise. But I want to challenge you to know that this provider is qualified to help you when you get into some of the more complex issues that might involve your hormone levels, your immunological state, the health of your gut. So if your provider says that they've received a 6-month certificate from a program that they took to become a functional medicine nutritional specialist, yes, they have completed that program, but that doesn't mean that they have the experience to give you all the information and all the guidance that you need to make good choices. So what do you look for in a practitioner? I already reviewed with you my bias in terms of professional training, because doctors of medicine and doctors of osteopathy have all done 4 years of their training in addition to 4 years of postgraduate training. And I think that that gives you the foundational understanding of biology and physiology and disease states to really be able to understand how we can incorporate some of these other modalities to address your health. So a sound understanding of science and of biology and biochemistry is fundamental to your success. Before you spend a lot of time, energy, and money, and God forbid, before you start taking a bunch of supplements from a provider, I want you to do an objective assessment of their degree of training and the number of years of experience they have in this field. Remember, medicine is defined as a practice. The more patients you've seen, the more experience that you've had, the more literature that you have read, the better you are to help your clients, your patients, to find a course of action which is most beneficial for their health. Okay, this concludes this series of videos on functional medicine and why it's different from allopathic medicine. I hope that this has been helpful to you guys. And as always, I welcome your comments. I would encourage you all to subscribe, leave a comment, share this video with your friends if you find that it is valuable. And as always, I'm making these videos for you. Once again, I'll see you guys in another video, and take care.